Hi, this is Michael from Exotech, and I'm in one of the hospitals in Poland. I will show you how we work with Luna with spinal cord injuries and especially with spinal canal narrowing. Okay, so we're here with Rafał. Rafał had an L1 vertebrae injury when paragliding. He fell from a height and we're starting therapy. So the first thing we want to do is actually diagnose if there is innervations in different muscle groups. Rafał actually has problems lifting his legs. So he does ride a wheelchair, but we want to know what kind of electrical signals are inside, and this is the first step. We already have electrodes snapped in to different muscle groups, and we will be focusing on each one, analyzing if the innervation really exists and what kind of electrical signals on electromyography actually are there. So we've already placed electrodes 4 centimeters apart on the head of the muscle we're analyzing. This is actually the quadriceps muscles of the thigh, and we're going to be strapping one channel of the same color to those kinds of electrodes, and we're going to be using one green reference electrode to any muscle group we want to analyze. It can be placed anywhere. So we can have up to 4 of those kinds of channels analyzing different muscles and gathering information about innervation of those muscles. So we'll be checking for innervation. So the first thing I want Rafał to do is actually flex and extend the knee. Try extending and now flexing. As you can see, the movements are limited, but what we want to see if the electrical activity comes to the muscles. So what we're going to be doing is adding a new training to Rafał's, and this is diagnostic EMG. And we're going to be starting. Okay. We can see 2 muscles being connected. I did the quadriceps right now, and in the meantime I strapped the antagonist as well. So the red channel is actually the extensor, the quadriceps muscle, and we'll be focusing on innervation in this one. So if you try extending, Rafał, you can actually see that the signal goes up, it's amplified, and we can easily detect that this muscle is innervated, and we can use that for therapy in just a minute. For Rafał, we're going to be using the lower limb extension. We'll be fitting it to Luna as we speak, and we'll be doing therapy with EMG for neurology. So with Rafał, we're going to be doing a new training with electromyography, T and H, trigger and hold, and we're going to be going next. The first thing we set up are the ranges of motion. So with strapped in, we're going to be extending the knee and flexing it as well. This is the passive movement. I'm doing this for Rafał. I'm going to stop it and relieve the weight relief with Luna to compensate for the weight of the limb itself. I'll be selecting the channel that will be doing the flexing. This is actually channel 1, the quadriceps I want to flex. And flexion up means that the robot will be going up. And we're going to be launching. We can already see the 2 channels. The first thing I do is go to calibration. Rafał, if you relax right now, you can see that EMG channel, the first one, the red one, is pretty much stable. But try extending it, your knee right now. You can see it easily goes up and relax now. It relaxes now. It's not enough to lift Rafał's leg, but it's enough to generate electrical activity. So right now, while Rafał is relaxed, Luna is also relaxed and flexed. If you try to extend, Luna actually assists Rafał while extending and relaxed. As you can see, all of this is done for assistance of Rafał. So it's not passive movement. It's actually generated through the muscle, through the quadriceps muscle to Luna, analyzed, diagnosed, and then assisted for movement. Try again. This way, you can really assist spinal cord injuries. You can work with multiple sclerosis, with brain strokes, with spinal cord injuries, and now relax. So this way, Rafał can have an active form of treatment. It works with brain strokes, spinal cord injuries, muscle atrophy. So any kind of innerved muscles can be used for active treatment, and this works flawlessly with Luna, and it's the way to work with neurological patients of the future.